right, I'm going to gather all my supplies. I'm going to provide privacy. I'm going to do hand hygiene. Hi, my name's Shannon. I'll be your student nurse today. Can you tell me your name and date of birth? Okay, awesome. Check your wristband. Awesome. Can you tell me where you are right now? All right. Do you know the month or the date? Okay, awesome. Do you know who the president is? Okay, awesome. I'm going to do a general survey. I'm going to look at your skin, make sure you're comfortable, your body position. If we need to go to the bathroom prior to starting, we can do that as well. So what we're going to be doing today is a head-to-toe assessment. So I'm going to be basically assessing you from your head to your toe, making sure that everything is all right, you're not in any pain. We can assess your heart sounds, lung sounds, bowel movements, everything in between. I'm also going to start with your vital signs. So I'm going to take your respirations, which are normally 12 to 20. I'm also going to take your blood pressure, which is normally 120 over 80. I'm going to take your pulse ox, which is normally 92 to 100. I'm also going to do your heart rate, which is normally 60 to 100. Also going to do your temperature, which is normally 90.6 to 100.3. And then we're going to start with your cranial nerves. So I'll start with cranial nerve number 1, which is olfactory. So I'm going to take something very common. I'm going to have you close your eyes. I'm going to occlude one nostril, and you let me know what you smell. All right, awesome. I'm going to take a different object to test your sense of smell and occlude the other nostril. And let me know what it is. Okay, amazing. For cranial nerve number 2, your optic nerve, I'm going to stand 20 feet away with a Snellen chart, and you're going to let me know until what line you can read the letters and the numbers. For cranial nerves 3, 4, and 6, ocular, motor, trochlear, and abducens. I'm going to take a pen light and test your eyes and see if your pupils are equal, round, reactive to light, and accommodation. Okay. I'm also going to do an H pattern. Just follow my pen light. Awesome. I'm also going to test your trigeminal, which is your number 5 cranial nerve. I'm going to press a soft and a dull object against your skin, and you're going to let me know where I am poking you. And just point to it where you feel a sensation. Awesome. I'm also going to assess your 7th cranial nerve, which is your facial. So I'm going to have you smile, frown, scrunch up your face, puff up your cheeks, and raise your eyebrows. For cranial nerve number 8, I'm going to do a whisper test to test your hearing. So I'm going to make a sound in one ear and whisper in the other. So A, B, C. You're going to tell me what you just heard. Do a different sound in the other ear. 1, 2, 3. Let me know what you just heard. I'm also going to do cranial nerves 11, which is going to be your spinal accessory. So I'm going to have you push your shoulders up against my hands. Okay, awesome. I'm also going to do cranial nerves 9, 10, and 12, which is going to be glossopharyngeal, vagus, and hypoglossal. For that, I'm going to test your gag reflex. I'm going to have you stick out your tongue for me, move it side to side to make sure it's midline. I'm also going to assess the oral cavity. I'm also going to check out your head, hair, hairline, make sure everything is symmetrical, your ears are symmetrical, your eyes, your nose is midline, so is your mouth. Make sure your lips are pink and moist. Gonna make sure your gums and teeth are okay. Gums are pink, there's no swelling. Next, I'm going to assess your carotid. So what I'm going to do is I'm going to first inspect the neck, and then I'm going to auscultate. And a palpate. And while I'm here, I'm going to feel your lymph nodes. So I'm going to feel your tonsillar, your submental, preauricular, postauricular, occipital, supraclavicular, anterior cervical, and posterior cervical. I'm also going to examine the chest for any abnormalities and asymmetry. I'm going to tell the patient what I'm doing. I'm going to pull down the shirt a little. I'm going to start listening to heart sounds. So I'm going to first listen to the aortic, which is going to be on the right side, second intercostal space. Then I'm going to listen to the pulmonic, which is going to be second on the left side, second intercostal space. And then herbs, which is going to be on the third intercostal space on the left side. Then I'm going to listen to tricuspid, which is going to be the fourth intercostal space on the left-hand side, and then mitral, which is going to be the fifth intercostal space midclavicular line. And I'm going to do that with the bell as well. And while I'm here, I'm also going to feel for the aortic pulse. I'm also assessing for temperature, moisture, skin integrity, all over skin integrity. I'm also going to listen for breath sounds. Take a deep breath for me. I'm also going to do that posteriorly as well. Have the patients flip over. I'm also assessing the skin, feeling for temperature with the back of my hand, especially for any moisture. And then take deep breaths. All right, next I'm going to move on to the arms. Assessing for overall skin integrity, making sure there are no bumps, lumps, bruises. I'm feeling for temperature with the back of my hand. I'm also assessing the range of motion for both arms. And I'm going to have them grasp my hand, squeeze tightly. I'm also going to assess for capillary refill, should be less than 1 second. I'm also going to assess skin turgor on the back of the hand and on the chest. The skin should bounce right back. I'm also going to feel for the pulse, radial pulse. So now I'm going to move on to the abdomen. First, I'm going to inspect the abdomen, make sure there's no lumps, bumps, bruises, edema, swelling, anything of that nature. Make sure everything is symmetrical and even. So I'm first inspecting, and then I'm going to auscultate in each quadrant. If I don't hear anything in a quadrant, I'm going to listen in each quadrant for 5 minutes. Next, I'm going to percuss. And then I'm going to lightly palpate. I'm also going to feel for temperature and moisture. Then I'm going to move on to the genital region. I'm going to make sure everything is all right. There's no swelling. Assess for temperature. Make sure everything's okay. If there's any catheters or tubing, make sure that's properly in place and there's no discomfort. I'm also going to feel for the femoral pulse while I'm here. All right. And I'm going to move on to the legs. All right. First, gonna have you push against my hands and pull against my hands. I'm going to assess your range of motion. I'm doing a general survey as I'm doing this, so I'm assessing for temperature, moisture, make sure the skin integrity is fine, no lumps and bumps. I'm also going to assess for the popliteal, the dorsalis pedis, and the posterior tibialis. Make sure there's no sores. Also gonna quickly listen for the lung sounds on your side. And if I haven't said it already, I would listen to the aortic pulse for a full minute. All right, and if the patient was in good health and they were able to get up out of bed, I would assess their gait and use the Romberg test and have them walk back and forth. And I would also have them stand with their eyes closed for 20 seconds and see if they get dizzy, to assess their gait and their balance. Otherwise, I think that I also need to assess for the clubbing and the capillary refill if I haven't already on both their hands and their feet. And I think that I would document all of my findings, and I talked appropriately with the client and communicated appropriately. And if there's anything abnormal, I would definitely document that as well. And I think that concludes my skills test.